Miss Smith is on the shaving list for today, and she needs her nails done, so we're gonna do nail care first. So the first thing we need to do is knock. Hi, Miss Smith, my name is Sue, and I've got to do nail care, and I've got to shave your face today, is that all right? Can you tell me your full name and birthday, and you're gonna look at her name? Says Steve Wade, but we're gonna call her Miss Smith, okay? So we're gonna do nail care first, is that okay? So we're gonna do nail care first. So I'm gonna remove all my stuff that I've gotta do for shaving and just do nail care. And I need a towel, and I need emesis basin, and I need my orange stick, and I need my clippers, and I need my emery board. And I need to know what about Miss Smith before I shave, before I do nail care.
If she's diabetic.
If she's a diabetic. If she's a diabetic, can I do nail care?
No.
No. So I'm gonna go ahead and get her raised. I'm gonna go ahead and raise her up in a Fowler's position. Now I'm not raising the bed rails, because I don't need to. Because this needs to be done in a seated position. So I'm gonna put her in a Fowler's position. I'm gonna go ahead and take your call light, Miss Smith, and you tap me on the shoulder if you need me. I'm gonna get my water in my emesis basin. It's gonna be warm water. I'm gonna put my emesis basin on some paper towels.
Does it matter what the grain?
Well, I mean, it's just warm water. I mean, warm enough that she can soak her nails in it like you would wash your hands, alrighty? So I'm gonna put this across her. I'm gonna let her hands soak for 5 to 10 minutes, alrighty? I would rewarm the water as necessary because I can't get both of them in there. So I'm gonna rewarm it as necessary. So now I'm gonna take my orange stick. I'm gonna take the pointy end and I'm gonna clean up under each nail. Like I wouldn't mind washing my hands, okay? So I'm cleaning after each nail. Now, after I clean the hand, I'm gonna take my towel and I'm gonna pat it dry. It's easier to clean when the nails are wet, and it's easier to cut the nails when the nails are dry. So I'm gonna take my clippers and I'm gonna cut straight across. Alrighty, straight across. Not at an angle, but straight across. I'm gonna take my emery board, and now I'm gonna shape the nails. I'm gonna take the flat part of this orange stick and I'm gonna push back the cuticles. Either that or I'm gonna use a washcloth, alrighty? Now I'm gonna move the paper towel emesis basin. I'm gonna let this hand soak 5 to 10 minutes and I will rewarm the water as necessary. Alrighty, then I would clean out from under her nails. Cause I'm gonna let you know this, that ain't food under her nails, alrighty, it's probably poop. That's just what I'm gonna let you know, it ain't, you see there's no gloves for this skill, but in real life you're gonna do what? Wear gloves. Because it ain't food underneath her nails, I promise you that. And it ain't gonna be food under Mr. Wade's nails either. So sometimes they play in their poop. And I'm gonna cut her nails straight across again. After I pat them dry. And I'm gonna take my emery board and shape them. Take my flat of my stick or a washcloth, your face like you mask, okay? So now I'm going to raise my rail. I'm gonna leave her sitting in that Fowler's position. I'm gonna raise her rail. Now I'm gonna go get me some water, Miss Smith, for your, to shave with, okay? And I'm gonna pick me up some gloves while I get my water, okay? This is how you'll check off on this skill. You'll do nails and you'll do shaving as a bundle, alrighty? Okay. I'm gonna get me some water. The water is between 110 and 115 because we're what?
Shaving.
We're shaving and it's on the face, right? So if you think about bath water, it's about that temperature, okay? So I've got some gloves, I've got me some water, I've got some washcloths, and I've got some shaving cream, or I've got soap, whichever one that he prefers, okay? Or she prefers. Now, I'm gonna raise the bed to my working body height. I'm gonna lower the rail. I'm gonna put a towel across him, or across her. Now I'm gonna put on my gloves. And I'm gonna take my washcloth. I'm gonna make this the face. I'm gonna take my washcloth. I'm going to make a mitt. I'm going to wash his face, or her face. I'm not gonna dry it, so I'm gonna get it back in the water again. Now I'm gonna undo the washcloth. I'm gonna hold it over their face for at least 3 to 5 minutes so I can soften the beard. I will not dry the face after I do that, alrighty? Okay, sit there, quit. Alrighty, so that's been 3 to 5 minutes. So now I'm gonna use some shaving cream. You all don't have to use a lot because this stuff grows. Like, right? Get a little in your hand. Put it on the face. Wash your hands off. Dry your hands with your washcloth if you want to. You're going to take the, now what do I need to know about this patient before I shave him?
Some blood thinner.
He's on the anticoagulant, right? So I'm going to pull taut on the side, long strokes, cleaning my razor frequently, shaving with the growth of the hair. I'm going to this is his undernose, short strokes. I'm observing the skin for what? Nicks and cuts. What am I doing if I get a nick or a cut? I'm applying pressure. I'm gonna make sure I've got all this shave creamed on. Then I'm gonna take my razor. I'm gonna get my washcloth. I'm gonna wash off the excess shaving lotion or shaving cream. Take my towel, dry the face. I'm going to look for any nicks or cuts. If he doesn't have any nicks or cuts, I'm going to ask him or her if she wants some aftershave lotion. I'm now going to remove my gloves. The bottom of the bed is dirty. I'm going to straighten my bed rails.